I've opened chests in emergency rooms where the cause wasn't disease. It was a pill people trusted, not a rare toxin, not a mysterious poison. Just a small, familiar tablet taken the way it had been taken for years, without fear, without hesitation, without a second thought. That's the illusion I want to break today. Most people believe that if a doctor prescribed it, or if it sits openly on a pharmacy shelf without needing a prescription, then it must be safe. Safe enough to take whenever pain shows up, safe enough to use every night, safe enough to trust without question. But here's what most people miss, and I say this as someone who has spent decades looking directly at failing hearts. Many medications were originally tested on younger adults. Stronger kidneys, faster livers, more resilient blood vessels, bodies that could clear drugs quickly and recover from small mistakes. But after 60, your body becomes a very different machine. Your kidneys, the filters that remove waste and excess medication, slow down. Not dramatically overnight, but steadily, year by year. Think of it like a coffee filter that once drained smoothly, but now lets liquid pass through more slowly, drop by drop. Your liver, the organ responsible for breaking down drugs, also loses speed. The same dose that once moved through your system efficiently now lingers longer, circulating in your bloodstream like traffic stuck on a crowded highway. And when drugs stay in the blood longer than expected, something dangerous happens. A dose that was perfectly safe at age 50 can behave like an overdose at age 70. I remember one patient clearly. A quiet man in his 70s who had taken the same over-the-counter medication for joint pain for nearly a decade. Never had trouble. Never had side effects. It was part of his routine, like brushing his teeth. Until one morning he didn't wake up feeling right. His heart was racing. His blood pressure was dangerously high. By the time he reached the hospital, his heart was under extreme stress. Not from disease, but from a medication his body could no longer handle the way it once did. That is the danger of familiarity. Have you ever taken a pill you trusted simply because it was familiar? Because you've used it for years? Because it helped once? Because everyone else around you takes it too? Here's the truth I want you to remember as we move forward. The most dangerous medications are rarely the rare ones. They are the common ones. The ones sitting quietly in your cabinet. The ones you no longer think twice about. Let's start with the one I see blamed most often when hearts suddenly fail without warning. Let's start with the medication I see blamed most often when hearts suddenly fail without warning. NSAIDs, ibuprofen, naproxen, diclofenac. If you open the medicine cabinet in almost any home, especially where someone over 60 lives, chances are you will find at least one of these sitting there quietly. Trusted, familiar, used without hesitation, and I understand why. You wake up with stiffness in your lower back. Your knees ache after walking. Your shoulder throbs after a restless night. So you take one pill, maybe two, and within an hour the pain fades. Relief feels harmless. But inside the body something very different may be unfolding. Here's the problem. NSAIDs can silently push your blood pressure higher, sometimes without you feeling a single warning sign. And the mechanism is surprisingly simple. These medications cause your body to hold on to salt and water. Not dramatically at first, just a little more fluid staying inside the bloodstream than your body was designed to carry. Now imagine your blood vessels like an old garden hose that has been used for decades. Flexible once, but now a little stiffer, a little narrower. Then imagine forcing more water through that hose than it was built to handle. Pressure rises. That's exactly what happens when fluid builds up in an aging cardiovascular system. Your heart, already working harder than it did decades ago, must now pump against higher resistance. Every beat becomes heavier work. And here's what makes this especially dangerous. You may not feel it happening. No pain, no alarm, just numbers on a blood pressure monitor slowly climbing higher week after week. But there's a second mechanism that worries me even more. NSAIDs don't just affect fluid, they also interfere with the delicate lining that protects your blood vessels. That lining normally keeps blood flowing smoothly. When it's disrupted, platelets, the tiny cells responsible for clotting, become stickier, more likely to clump, more likely to form a clot. and a clot, depending on where it forms, can become a life-ending event in minutes. In the coronary arteries, it becomes a heart attack. In the brain, it becomes a stroke. I remember a patient, a retired teacher in her late 60s, who had been taking diclofenac almost daily for knee pain. Weeks turned into months. The pain stayed under control, so no one questioned the routine. Until one afternoon, she felt a sudden crushing pressure in her chest. Not after heavy exercise, not after emotional stress, just while sitting at home. By the time she reached us, a clot had already blocked one of the arteries feeding her heart. The medication that helped her walk more comfortably had quietly been setting the stage for the event that nearly took her life. And stories like that are not rare. We have seen again and again that long-term or frequent use of NSAIDs in older adults can significantly increase the risk of serious cardiovascular events, heart attacks, strokes, sudden worsening blood pressure. So serious, in fact, that regulators required what we call a black box warning on many of these medications. In medicine, that is the strongest warning label we give. It means this risk is not theoretical. It is real. It is documented. It has cost lives. Now, let me be very clear. This does not mean you must never take these medications again, but it does mean you should never treat them as harmless daily companions without medical guidance. If you find yourself reaching for ibuprofen or diclofenac every single day, if it has become part of your routine like morning coffee, that is your signal to pause and ask a deeper question. Is this medication still safe for my heart at my age? Because relief from pain should never come at the hidden cost of damaging the very organ that keeps you alive. But pain relief is not the only danger hiding in plain sight. Now let's talk about a medication many older adults take for a reason that feels completely innocent: sleep. They toss for an hour, they wake up at 2 a.m., they feel restless, frustrated, exhausted. So they reach for a familiar PM pill or an over-the-counter sleep aid containing diphenhydramine, thinking, I just need a little help getting through the night. And that is exactly why this danger is so often missed. Because it does not look like a heart risk, it looks like a sleep solution. But diphenhydramine has what we call an anticholinergic effect. That sounds technical, so let me make it simple. Your heart runs on electrical timing, not just muscle strength, but signals. Carefully coordinated messages that tell it when to speed up, when to slow down, and how to stay in rhythm. Anticholinergic drugs interfere with part of that signaling system. It's like scrambling the electrical wiring of your heart. In a younger body, that disturbance may be small. In an older body, especially one already dealing with aging blood vessels, mild conduction problems, or hidden heart disease, that same disruption can be much more dangerous. The heartbeat may become faster, less stable, more chaotic. And the timing of all this matters. Night is when the body is supposed to shift into a more protected state. The nervous system slows, blood pressure changes, the heart settles into a quieter rhythm. But when you introduce a medication that disturbs that balance, you can create the perfect setup for rhythm problems at the exact moment the body is most vulnerable. I have seen families shocked by this. A loved one took a common nighttime pill, went to bed as usual, and by morning something was terribly wrong. In one case that has stayed with me, an older patient had been using an over-the-counter sleep aid for several nights in a row. No prescription, no warning taken seriously, just a familiar product from a store shelf. He never woke up normally again. By the time the emergency team was involved, the damage from a nighttime cardiac event had already been done. And even when these pills do not trigger a catastrophic rhythm problem, they create another layer of danger over time. They can cause morning grogginess, confusion, blurred thinking, memory problems that people mistake for just aging. They can make someone unsteady when getting up to use the bathroom at night. And in older adults, one fall can change the course of a life. That is why I want to say this clearly. Do not treat diphenhydramine-based sleep aids as a harmless nightly habit just because they are sold without a prescription. If you are over 60 and using PM medications regularly to sleep, that is not a small detail. That is something worth reviewing with your doctor or pharmacist, especially if you have high blood pressure, palpitations, dizziness, memory changes, or a history of heart disease. Because the pill that seems to quiet the night may be quietly disturbing the heart. And then comes the medication many people take without thinking twice during a simple cold. Now let's talk about a danger that catches many older adults completely off guard: Because it often begins with something as ordinary as a stuffy nose. You get congested. You cannot breathe well. You feel pressure in your sinuses. So you reach for a cold medicine that promises fast relief, something with pseudoephedrine or phenylephrine. It seems simple. It seems routine. It seems like the last thing that would send stress through the heart. But here is what most people are never told. These medications work by tightening blood vessels. That is how they open the nose. They shrink swollen tissues by constricting the tiny vessels inside the nasal passages so you can breathe more easily. The problem is, they do not only tighten the blood vessels in your nose, they can tighten blood vessels throughout the body. It is like tightening every pipe in the house at once. Now imagine what that means for an older cardiovascular system. The heart suddenly has to push blood through narrower channels. Resistance rises, pressure climbs, and that rise can happen fast. For someone who already has high blood pressure, coronary artery disease, an irregular heartbeat, or a heart that has grown stiff with age, this is not a minor inconvenience. It can become a trigger. A trigger for a blood pressure spike, a trigger for chest pain, a trigger for palpitations, and in some cases, a trigger for a medical emergency. I remember one older man who took an over-the-counter cold medicine because he simply wanted to sleep through the night without feeling blocked up. Within hours, he developed pounding pressure in his chest and a sensation that his heart was working too hard. By the time he was evaluated, his blood pressure had surged dangerously high. What began as a common cold had turned into a cardiovascular crisis because of a medication he never thought to question. That is the trap. People think of cold medicine as light medicine, temporary medicine, harmless medicine, but in an older body, a decongestant can act less like a comfort drug and more like a stress test the heart never agreed to take. And the risk becomes even greater when the person already takes medications for blood pressure or heart disease. Sometimes these drugs push in opposite directions. Sometimes they overwhelm the body's ability to compensate. Either way, the result can be instability. So here is the action step I want you to remember. Read the label, not casually, carefully. If you see pseudoephedrine or phenylephrine, stop and ask whether this is safe for your heart, your blood pressure, and your age. If you already have hypertension, heart disease, or a history of stroke, do not assume these products are harmless just because they are sold over the counter. Because sometimes the medicine meant to help you breathe more easily is the very thing making your heart work harder. But the most dangerous situation isn't one drug alone. Now we come to the part that frightens me most, not because it is dramatic, but because it is so easy to miss. It is not one pill, it is the pileup. By the time many adults reach their late 60s or 70s, they are no longer taking just one medication. They may be taking something for blood pressure, something for pain, something for sleep, something for mood, something for allergies, something for the stomach, and a few supplements they picked up along the way because someone said they were natural and safe. And on paper, every one of those choices may look reasonable by itself. That is exactly why polypharmacy is so dangerous. Polypharmacy simply means taking multiple medications at the same time. But the real problem is not the number alone. The real problem is interaction, layering. The way one drug quietly amplifies the effect of another until the body is dealing with a burden no single prescription list reveals. It is not one storm, but three storms colliding at once. One medication raises blood pressure. Another speeds the heart. Another causes fluid retention. Another makes the brain foggier and balance less steady. Separately, each may seem manageable. Together, they can push an older body into chaos. I want you to picture a woman in her 70s. She takes ibuprofen most days for knee pain because she wants to stay mobile. She takes an antidepressant because grief and isolation have weighed on her more heavily in recent years. And at night, when sleep does not come easily, she reaches for a PM pill with diphenhydramine. Now step back and look at what is happening inside her body. The ibuprofen may be raising her blood pressure and making her retain fluid. The antidepressant may be affecting heart rhythm or interacting with other medications. The nighttime pill may be speeding the heartbeat, causing confusion, and disrupting the electrical stability of the heart while she sleeps. No one pill announces itself as the villain, but together, they are attacking her cardiovascular system from multiple directions at once. And this is what makes the danger so hidden. Most people never see the full picture. The orthopedic doctor may focus on the knee. The primary care doctor may focus on mood or blood pressure. The pharmacist may not know every over-the-counter product being used at home. The patient may not think sleep aids, allergy pills, pain relievers, and supplements count when asked about medications. So the interaction stays invisible until the dizziness starts, until the blood pressure runs high, until the heart rhythm turns unstable, until the fall happens, until the emergency room visit no one saw coming. I have seen this pattern too many times. Families are often told, "It was the heart," or "It was a stroke," as if the event came out of nowhere. But when you trace the story backward, you often find a silent buildup, medication on top of medication, effect on top of effect, pressure on top of pressure. That is why the real danger of polypharmacy is silence. No loud warning, no dramatic symptom at the beginning. Just a slow stacking of risk in a body that has less room for error than it did 20 years ago. And this is where awareness becomes your strongest protection. So how do you know when a medication is no longer helping your body, but quietly harming it? In older adults, the warning signs are often subtle. That is what makes them so dangerous. They do not always look like a medical emergency at first. They often look like just getting older. That is the mistake I do not want you to make. The first sign to watch for is dizziness. If a medication is dropping your pressure too fast, disturbing your heart rhythm, dehydrating you, or changing how your blood vessels respond when you stand up, dizziness may be the first clue. Many people shrug it off, but dizziness is not always harmless. In an older adult, it can be the first step toward a fall, a fracture, or a hospital stay. The second sign is a racing heartbeat or palpitations. That can happen when a drug stimulates the system, disrupts the heart's electrical timing, or interacts badly with another medication. Some people describe it as fluttering. Others say, "My chest just doesn't feel right." Listen to that feeling. The heart often whispers before it screams. The third sign is swelling in the legs or ankles. That usually means fluid is being retained. Some medications cause the body to hold on to salt and water, increasing the load on the heart and pressure inside the blood vessels. Shoes feel tighter. Socks leave deep marks. Ankles look puffier by evening. Those are not small cosmetic changes. They may be signs the cardiovascular system is under strain. The fourth sign is confusion. If a medication affects the brain, disrupts sleep quality, causes dehydration, or stays in the bloodstream too long, thinking may become slower and foggier. A person may seem more forgetful, more disoriented, or less steady in conversation. Families often call this normal aging. Sometimes it is not aging at all. Sometimes it is the medicine cabinet. And then there is unusual fatigue, not ordinary tiredness. I mean the kind of fatigue that feels heavier than normal, more sudden, more draining. The kind that makes simple daily tasks feel strangely difficult. That can happen when the heart is under pressure, when blood pressure is unstable, or when medications are affecting circulation and oxygen delivery. Have you ignored symptoms thinking they were just aging? Because that is exactly how early warning signs get missed. The body often sends quiet signals long before a crisis. The question is whether we recognize them in time. So what should you actually do? Starting today? So let's shift from fear to action. Because the goal here is not to make you afraid of every pill in your home. The goal is to help you use medication wisely, with the kind of respect an older heart deserves. Here is the 3-step protection plan I wish every adult over 60 would follow. Step 1. Write down everything you take, and I mean everything. Prescription medications, over-the-counter pain relievers, sleep aids, allergy pills, cold medicine, vitamins, herbal products, supplements your neighbor recommended, the magnesium powder in the kitchen drawer, the PM pill on the bedside table. Put it all on one list. Most people think only prescriptions matter. That is a dangerous mistake. I have seen serious problems caused not by one powerful prescription, but by a combination of small things taken casually from different bottles. You cannot protect your heart from interactions you never put on paper. Step 2. Ask for a real medication review. Bring that full list to your doctor or pharmacist and ask a direct question. Given my age, my heart, my blood pressure, and everything else I'm taking, is this still safe? That conversation matters more than most people realize, because a medication that was reasonable 5 years ago may not be the best choice today. Your kidneys may be slower now. Your blood pressure may be more fragile. Your heart may be less tolerant of rhythm changes, fluid retention, or sudden spikes in pressure. What used to be acceptable may now be risky. Do not be embarrassed to ask. Do not assume someone else has already checked every interaction. Sometimes the most life-saving question is the simplest one. Step 3. Explore safer alternatives when appropriate. For pain, that may mean topical NSAIDs instead of frequent oral NSAIDs. A cream or gel placed directly over the painful joint can sometimes reduce pain with less medication circulating through the bloodstream. For sleep, instead of reaching automatically for diphenhydramine-based PM products, your clinician may discuss options like low-dose melatonin or magnesium glycinate, depending on your situation and other conditions. The point is not that every replacement is perfect for every person. The point is that safer options often exist, but most people never look for them. And that is where your power begins. Because controlling your medications is not just about avoiding side effects. It is about protecting your blood pressure, protecting your heartbeat, protecting your balance, your memory, your independence. In other words, controlling your medications is part of controlling your health. And before we finish, I want to leave you with one truth I've learned after decades in operating rooms. So let me leave you with the truth I wish more families understood before a crisis forced them to learn it the hard way. A familiar medication can become a dangerous one when the body grows older. That does not mean medicine is the enemy. It means aging changes the rules. The pill that once passed through the body quietly can begin to linger, build up, raise pressure, disturb rhythm, or interact with other drugs in ways no one feels until something serious happens. And I want to say this as someone who has spent years around operating rooms and emergency cases. Many medical disasters do not begin with dramatic symptoms. They begin with small habits: a nightly sleep pill, a daily pain reliever, a cold medicine taken without a second thought. Quiet choices repeated again and again until one day the heart can no longer absorb the cost. But this is the hopeful part. Knowledge changes outcomes. When you know what to question, what to track, and when to ask for help, you protect more than a number on a chart. You protect your heart, your mind, your balance, your independence. So tell me in the comments, what medication are you or someone you love taking regularly that you now want to review more carefully? And please share this with a parent, a spouse, a relative, or any older adult who keeps a cabinet full of harmless pills. And one important reminder before we close. This content is for education only. It is not personal medical advice. Do not stop, change, or reduce any prescribed medication on your own. Always speak with your doctor or pharmacist before making changes, especially if you have heart disease, high blood pressure, kidney problems, or a history of stroke. Protect the heart by respecting the small things before they become big ones.